Hello, my name is J.R. Creveling, and today I will be discussing whether doctors should be allowed to provide all forms of gender-affirming healthcare to minors. So, what does gender-affirming care mean? First, I'm going to define a few terms so that the audience will be able to understand some of the more technical terms I will be using in this presentation. The first is biological sex, which is based on someone's biological physical characteristics and will be assigned to them at birth. Next is gender identity, which is the way a person acts and thinks based on society's socially constructed binary roles of male and female. Gender affirming care is the term used for various types of social and psychological medical interventions that can be provided to gender diverse people, meaning their gender does not conform to their binary role of male or female, in order to affirm their gender identity. Gender dysphoria is the distress a person might feel due to a disconnect between their sex assigned at birth and their gender identity. There were 42,167 new diagnoses of gender dysphoria in people 6 to 17 years old in 2021, so clearly this is not an uncommon condition. So, some of the most common forms of gender affirming care are hormone replacement therapy, or HRT, therapy and social supports in general, speech therapy, puberty blockers, and surgical interventions, which I will be discussing in greater detail later in this presentation. This type of care is used to alleviate gender dysphoria and to help gender diverse people feel more comfortable in their bodies and in their identities. So, who is gender affirming care for? There are many different identities that fall within the broader gender nonconforming or transgender umbrella, including identities such as transgender, non-binary, gender fluid, and many, many more. This type of care is ultimately for anyone who feels that the gender they were assigned at birth does not align with their gender identity or who wants to explore their gender identity and how they present themselves to the world. This issue is important for a variety of reasons. In the US, there is currently a very prevalent political and legislative argument surrounding whether gender-affirming care should be offered in general, but especially for minors. In 2023 alone, there were 142 bills proposed to restrict gender-affirming healthcare. Parents and other adults are scared for their children because they often do not know what gender-affirming care actually entails, or the safety of such treatments for their children. These bills would have a large impact considering that 1.4% of youths in the US are transgender, based on a compilation of studies from 2014 to 2015 and 2017 to 2019. Additionally, there is currently a large gap in the education of our healthcare professionals surrounding LGBTQ care. One study shows that 150 medical schools in the US and Canada have a total of 5 hours spent on this care in their entire curriculum, leaving many healthcare providers feeling inadequately prepared to treat people from this community. My first pro is that gender-affirming care is crucial to mental health for these children. Gender-diverse youth experience disproportionate rates of depression and suicidal thoughts and/or actions compared to their peers. Studies have found that when these adolescents are provided access to gender-affirming care, such as puberty blockers and HRT, they had lower rates of both. Those who used gender-affirming care for a year had 60% lower rates of depression and 73% lower rates of suicidal thoughts and actions than the transgender and non-binary youths who did not have access to this care. This shows a large improvement in the mental health of these children due to the use of various forms of gender-affirming care, meaning that access to this care is positively affecting these children. The next pro argues that there are a variety of treatment options available to patients. These treatments usually start with therapy and social support, which involve talking to a qualified mental health professional about one's gender and the potential disconnect they're feeling between that and their biological sex, as well as beginning to use the corresponding clothing, names, hairstyles, pronouns, and other social factors that align with their preferred gender identity. This type of care is used at any stage or age in a person's transition. The next form of care offered is puberty blockers, which are used to delay the changes that come with puberty while a child explores their gender. They are offered during puberty, which usually begins around the age of 10 or 11, and can be reversible, although there can be other side effects that have to be closely monitored while taking them, and usually mean a person has to stop taking them around age 14 to minimize potential adverse side effects. Additionally, a person usually has to show a long-term pattern of gender dysphoria or nonconformity, as well as an increase in dysphoria at the onset of puberty in order to even access this type of care. The next is speech therapy, which someone does to train their voice to sound closer to their preferred gender identity. And this is usually started at or after puberty when the voice begins to change, and can be reversible. Next is sometimes starting hormone replacement therapy, which involves taking testosterone or estrogen, depending on your assigned gender at birth, in order to begin medically transitioning to appear as your preferred identity. This is also where irreversible or partially reversible treatments begin, and is commonly started around age 14 or 15. Finally, there is surgical intervention, which is much less common for minors and involves various procedures that make a person's physical appearance match their preferred gender presentation. It is much more common for this step to be done sometime in adulthood and is much more restricted for minors. Additionally, not all gender diverse people will undergo all of these treatments. The transition experience will be different for every person based on what they personally want or feel comfortable with. So if a person or parent is not comfortable with one treatment, there are other options available for these children to still get this care. The final pro argument is that having access to gender-affirming care ensures the safety of transgender and gender-diverse children. Having access to this care allows children to safely explore their gender identity, which is a normal aspect of development for children as they grow. Not all children will decide that they are transgender, but this care being accessible will ensure the freedom to figure it out without the added stress of uncertainty that there are things to help make them more comfortable in discovering who they are. If gender-affirming care was banned, it would likely lead to children pursuing unsafe alternatives, such as non-prescribed hormone treatment or other social practices like unsafe chest binding in order to appear more masculine or gender neutral, which can lead to dangerous medical conditions that would have long-term impacts on the child's health. The first con I will be discussing is that a minor's decision-making ability is not fully developed, and they therefore are not fully capable of making large medical decisions by themselves. Studies have found that adolescents, beginning around age 12, tend to take bigger risks, especially when in emotional situations. For example, making a big medical decision regarding their gender. Decision-making is further compromised because a child experiencing gender dysphoria might take extra risks to potentially alleviate this feeling of distress that they're in. The issue of informed consent, which is the ability to give consent once a person has been fully educated on the effect and consequences of a procedure or treatment, is also highlighted here. The fact that many doctors are ill-informed on these issues means that they might not be able to explain to the child or to the parents adequately enough for them to really give informed consent, or even to be able to provide a family with all of the options that their child has. Additionally, the parent must usually give consent in these situations because they oversee making medical decisions for their children, and they're not going to want to consent to something that they do not feel comfortable with or that they don't understand. The next con is that some of these gender-affirming treatments can have long-term physical and mental consequences for the child. The research on these treatments is still very uncertain and is made even harder due to HIPAA and other ethical issues regarding the study of children. There is little research or statistics about most of these treatments, but some have found that long-term use of puberty suppressors can harm bone mineral density, which a child might not be able to get back after stopping the puberty suppressors or after starting HRT. This must be very closely monitored when getting this treatment, but it can still pose a serious risk for the long-term health of the child. In 2021, 1,390 patients with a gender dysphoria diagnosis started using puberty blockers, and 4,231 started hormone treatments. Although the analysis does state that this is likely an undercount because of the difficulty of assessing records for the children regarding these treatments. This leads me back to the point that there is simply not enough knowledge or research about these treatments for them to be considered safe to give to our children. Finally, there are many social consequences for children who are transgender or gender diverse in our society. There, of course, will likely be backlash from family and or peers due to coming out or seeking gender-affirming care because of the way that our society views being transgender. These children will likely be ostracized at school, which will deprive them of the opportunity to socially develop at the same rate as their peers. Bullying can affect children during critical developmental stages in their childhood, which will impact them long into their adulthood. It has been widely proven that bullying leads to decreases in mental health. The CDC found that 80% of LGBTQ adolescents are bullied by their peers in some form, which is part of the reason that this community also tends to have much greater rates of depression and suicidality. Studies have also found that children who are perceived as different than their peers are at much greater risk of being victims of bullying. A child undergoing gender-affirming care is going to be seen as different because it's not something that most children have to go through, which is going to be putting them at an even greater risk of being bullied and therefore having long-term effects on their emotional and mental health later into life. After taking in all of these points, is gender-affirming care for minors really beneficial? When it comes down to it, these children are incredibly vulnerable, and it is our responsibility to ensure their safety and decide whether the pros of these treatments outweigh the cons, and vice versa. There is a lack of research in this area that needs to be addressed to make a truly informed decision on the topic. As society becomes more accepting of LGBTQ identities, and more children start coming out as part of this community, we have to decide on issues like this to ensure that they have access to safe care. Again, my name is J.R. Creveling, and thank you so much for listening to my presentation.